Welcome, I'm Carolee Lee, founder and CEO of Wham, Women's Health Access Matters, a nonprofit, nonpartisan organization working to increase awareness of and accelerate funding for women's health research, because women's health is an economic issue we can't afford to ignore. This Wham report is titled The Case to Fund Women's Health Research, an Economic and Societal Impact Analysis, which we are releasing today. And it's the first rigorous data-driven study to measure the economic opportunity and impacts for funding health research that specifically focuses on women. I want to thank Senator Duckworth, Representative Beyer, Representative Peters, Representative Schakowsky, Representative DeLauro, and Representative Stevens for their understanding that the urgency and importance of both the health and economic impacts of women's health research is a priority for us all. I'd also like to acknowledge Dr. Janine Clayton, Director of the NIH's Office of Research on Women's Health, and Dr. Maria Freire, former Director of the Foundation for NIH. The NIA, the first to release the Wham report findings on Alzheimer's at this year's ADRD Summit, with Wham's Vice Chair, Meryl Comer, and Dr. Hadeen Jaffe, Executive Director of the Connor Center at Brigham Harvard and Wham's lead scientific partner. I also want to thank two incredible leaders in women's health, Marcia Henderson and Susan Denser, for their participation today and their support of the Wham report. Marcia, during your tenure as Associate Commissioner for Women's Health at the FDA, you built a seat at the table for women. You brought about real change and measured results, and you really inspired us to be able to enter and help accelerate this conversation and movement. And Susan, you're one of the most respected voices in health and health policy, and currently the chair of the Board of Research America. So thank you. And thanks to Wham's board and Wham's collaborators, the American Heart Association, the La Jolla Institute for Immunology, Bright Focus Foundation, and Research America, along with leading U.S. academic institutions like Brigham and Women's Connor Center, the Mayo Clinic, and the Laura Bush Institute for Women's Health, who support the Wham Collaborative to advance sex and gender-based research. Although it might be true that I'm most known for founding and leading a company built from my kitchen table into a global leading accessories brand, I always had a very deep interest in the health and well-being of my workforce, 85% of which was women. Women were at the heart of my company, both as customers and as employees, and my role led me to think a lot about the economic impact of women and to see that impact firsthand. I also saw the ways that health issues could impact women's finances and their careers, and the effect that illness could have on someone, on their family, on their business, and it turns out, on our entire economy. When I first learned about the disparities in women's health research, it was all I could talk about. And well, here I am, still talking about it. And what exactly is it that I mean when we talk about these disparities? Well, here's some of the data. 12% of Alzheimer's research, 7% of rheumatoid arthritis research, and 4% of cardiac artery research are allocated to projects focused specifically on women. Now, how is it possible that scientific research could be so insignificant for half the population? As a business leader, I tend to look at problems with economics in mind, and I believe the solution to these disparities lies in the economics behind them. In my experience in the C-suite and the boardroom, change starts with data. And it became apparent to me that we lacked evidence. We lacked data about the economic costs, benefits, and social impacts of attention to sex and gender research in health research. And that medical research gender gap is a major obstacle to not only achieving equity in healthcare, but to advancing the health and well-being of women around the world. As women globally drive the economy, that gap holds us all back. Before I dive into the data of the Wham report, we're fortunate today to have with us several esteemed guests who we want to hear from. Susan, I'll turn it over to you.
We all know that to get anything done in this world, in life in general, and particularly in Washington, D.C., means that we need champions. And so we're fortunate enough that two are joining us today by pre-recorded video, and 2 others we believe will be able to join us in person. We're going to start with one of those champions in the form of a video greeting from Senator Tammy Duckworth. Senator Duckworth has been a strong leader for advancing women's health and reaping those economic and social rewards for doing so. She recently led an effort to secure additional funding for biomedical researchers who are women, and along with Congresswoman Schakowsky, whom I will introduce in a minute, sponsored a resolution to recognize the need for awareness of sex and gender-based biomedical research. So Senator Duckworth, thank you to you and your incredible team for hosting this event. And let's go to your video message now.
Hello, everyone. Thank you for WHAM, all of the groups here today, and all the folks involved in this first of its kind report, the case to fund women's health research, which shows that women's health research isn't just good science, it's good investment for our nation. Women are more than half of the US population and make up 50% of our workforce, control 60% of our personal wealth, and are responsible for 85% of our nation's consumer spending and 80% of our healthcare decisions. Despite this, women's health is an economic and public health issue that we as a nation cannot afford to ignore any longer. Yet, even while diseases impact women disproportionately and we show different symptoms of life-threatening medical conditions, our nation's investment in women's health research lags. That is one reason why in the 116th Congress, I introduced a resolution with my friend and colleague from Illinois, Representative Jan Schakowsky, to designate January 25th, 2019 as Women's Health Research Day. And it's one reason why I wrote to Chair and Ranking Member of the Senate Appropriations Health Subcommittee, calling on them to highlight the importance of diversity in the biomedical research workforce and to support additional fellows in the Building Interdisciplinary Research Careers in Women's Health Program for fiscal year 2022. Because women across America with different racial, socioeconomic backgrounds and ages have different medical needs. This lack of representation can drastically limit access to life-saving medical innovations and treatments. If we as a nation want to make sure that women have access to the best healthcare possible, we need to start by ensuring a diversity of women are included when biomedical research trials are conducted. A great way to do that is by investing in more women in science. So thank you all again for conducting this important research and sharing these findings with our groups today. Be well.
And again, we thank Senator Duckworth for sponsoring our event today. We're very happy to be joined live and in real time now by Representative Don Beyer, Democrat of Virginia. He serves as the chairman of Congress's Joint Economic Committee and has been a strong advocate for women's health and women's economic empowerment.
Around the world, global R&D funding keeps increasing rapidly, but it's like mostly China. And they had 1/3 of the global growth between 2000 and 2017, compared to only 20% for the US, 17% for Europe. We are actually close to dropping out of the 10%, top 10 of the world in terms of R&D expenditures. We've had 2 good bills this year, the NSF for the future, National Science Foundation for the future in the House, USECA in the Senate. It literally doubles our basic research. But the notion that just $300 million could directly affect the 3 diseases that most touch women is a really inspiring thing. My good friends, Trish Vredenberg, the late Trish Vredenberg, her husband George, a couple of years ago noticed that we were spending $6 billion on cancer research, $6 billion on Ebola, and only $300 million, which is like 1/20th, on Alzheimer's. So they jumped in, made the case, and now we're spending $5 billion a year on Alzheimer's. We can do the same thing with women's health by making this a priority, and then the enormous payoffs will be right there. As the father of 3 daughters and the brother of 4 sisters, losing my mother at the tender age of 73, I really want this investment to go forward. And I'm just so pleased that the Wham Report accentuates its necessity for all of us. So thank you, Susan, very much. I look forward to listening through the course of this afternoon's event.
And thank you, Congressman Beyer, again for your leadership. We're going to go to another video greeting now from Representative Jan Schakowsky, a Democrat of Illinois. And Congresswoman Schakowsky serves on the House Budget Committee. She's long been a champion for women's health, for inclusion and advancement. And as I mentioned earlier, she teamed up with Senator Duckworth to introduce a resolution about the need for more research on women's health. So let's go now to that video greeting from Congresswoman Jan Schakowsky.
Hi, it's Congresswoman Jan Schakowsky. I just want to say a big thank you to Women's Health Access Matters, Wham, and to Research America for your leadership on these important issues. Nita Lowey, who is my dear friend who came to Congress 33 years ago, she just retired last session, said that when she came here, that not only was research not done on women, healthcare research, but even the rats were males. And things are beginning to change, but not enough. And the truth of the matter is that not only for women in general, but especially women of color, are underrepresented in the kind of research that we do and the kind of remedies that we have. So we have a lot of work to do. I wanted to let you know that in the last Congress, I introduced a resolution designating January 25th as Women's Health Research Day. We ought to consider doing that on a regular basis, that we create a day, that we underscore the need for research for women's health. And yet historically, that we have been left out. I have some data here. Only 12% of Alzheimer's research is done, focuses on women. Just 4% of the coronary heart disease focuses on women. Of course, women are 50% of the population, actually more than that when it comes to be the voters. So we have to make the changes that we need. And the data that you actually provided, I think, is so useful, that if we just focused on 3 diseases, Alzheimer's disease, coronary artery disease, and also rheumatoid arthritis, that the government would save $13 billion because of that investment and the progress that, of course, that we would make. So I just want to thank you so much for the focus that you're putting on women's health, on research on women's health, and the payoff that would not only be for our sisters, but also for the economy, for the federal government and our budget, and really advantaged in so many ways our country. So thank you. I'm sorry that I couldn't be with you today. I really appreciate the focus that you're having, and just want to partner with you in any way that I can. Good luck.
Well, again, Congresswoman Schakowsky, thank you for your leadership. Now we're going to go back to Carol Lee for presentation of the facts and figures behind the Wham report. So Carol Lee, over to you.
Thank you, Susan. And thank all of you. I know how busy Congress is right now with so many important national priorities, so I'm particularly grateful to have your focus here today on the Wham report and the health and wealth of our country. Until now, to the best of our knowledge, no one has evaluated the economic consequences of the status quo, the costs we incur, and the benefits we leave on the table when research under-includes women. And so to change this situation in 2018, I shared this data with a group of businesswomen to see if maybe we could change this scenario. And these incredible women were, like me, in disbelief when hearing the data, and frankly, they were immediately motivated to build a business case for funding a research project focused on women by asking, what might the economic impacts of increasing economic investment in women's health research be? And so we commissioned the RAND Corporation to begin a rigorous focused study to quantify the costs and socioeconomic benefits of increased research funding focused on women. And we applaud the expertise and commitment of the researchers and economists at the RAND Corporation for their outstanding work and their contributions. We chose 4 areas to study which we knew disproportionately, exclusively, or differentially affected women: brain health, autoimmune immune disease, cardiovascular disease, and cancer. And behind all of the work that went into that research were some simple but crucial facts that we kept at the front of our minds. And some of them I see Congresswomen have taken up, which I'm very grateful for. Clearly, women are the majority of the US population, nearly 50% of the workforce, control over 60% of personal wealth. And in the US, women are responsible for over 85% of consumer spending. That's more than $11 trillion. Women make over 80% of the healthcare decisions in the US. And as the CEO of Global Brand, I saw firsthand how women drive the economy. I also know from experience that when women are pulled from the workforce because of inadequate treatment options or to care for their families, there are direct economic consequences for our businesses, our families, and our economy. I'm not a scientist and I'm not a physician, and I don't need to be to tell you that male and female bodies are different and that the differences go way beyond our reproductive organs. So just consider how those differences manifest in health outcomes. Women are more than twice as likely as men to suffer from depression, 2 times as likely as non-smoking men to get lung cancer. Women are 80% of all patients with autoimmune conditions, and they're 2/3 of all patients with Alzheimer's disease. We're 50% more likely to die within a year following a heart attack than men. Now, we've figured out and we know that these differences and disparities exist. We can see it in the data when we bother to look, but collectively as a society, we still do not understand why. The NIH only began to ensure the inclusion of women in all clinical research after an act of Congress in 1993. And it was only 5 years ago in 2016 that NIH required studies to use female mice and animal cells in research. We have a lot of catching up to do. These delays have left us all with a weakened evidence base about women's health, and the impact is far-reaching. It does mean that when it comes to keeping our economy healthy, we're often using analysis and data that doesn't even apply to half of the population, the driving force and engines of the global economy. The analysis and the data does matter. Women are disproportionately and differentially impacted by some of the costliest diseases we face. We need more research dollars and investment in companies focused on prevention, diagnosis, and treatment on diseases which women are disproportionately affected by. And what this report has shown us is that coronary artery disease costs our economy over $555 billion a year. Women have worse outcomes than men, but only 4% of total research funding focuses specifically on women. Alzheimer's disease costs our economy $305 billion in 2020. Women are 66% of the patients, but only 12% of total research funding focuses specifically on women. Rheumatoid arthritis costs our economy over $40 billion a year. Women are 60% of patients, but only 7% of research funding focuses specifically on women. But here's some good news. It turns out that women's health research isn't just good science, it's a good investment, and it yields a far higher rate of return than general research. The Wham Report finds a higher rate of return for research focused on women across our initial disease areas: coronary artery disease, autoimmune, and Alzheimer's disease, driving billions of dollars to the economy through greater quality of life, workforce, and economic gains, and reduced healthcare costs. The Wham Report shows us powerful information across 3 very different disease areas. We can see clearly that this issue is not limited to one space. This is a critically important point. The Wham Report makes it clear that we can no longer ignore sex and gender health research connections across diseases. This is not just about women, everyone benefits. Sex and gender research is the gateway to the future of precision medicine. If we implemented the findings in the Wham Report together, we would invest a little over $300 million and get back over $13 billion. Doubling women's Alzheimer's research pays for itself 3 times over. Adding $280 million generates $930 million in economic returns, a 224% return on investment. That's a 15% higher return than we get for general research. And for every dollar invested, we get back $2 in quality of life improvements and $1.24 in healthcare cost savings. Here's some data from the report that clearly is quite profound. When we double investments for women's heart research, every dollar generates $95 to the economy. And for rheumatoid arthritis, every dollar generates over $1,700. And that makes perfect sense when you think about it. Heart and autoimmune diseases take women out of the workforce much earlier on average than Alzheimer's. Doubling women's coronary artery disease research pays for itself 100 times over. Adding a $20 million investment generates nearly $2 billion in economic returns, a 9,500% return on investment. Doubling women's rheumatoid arthritis research pays for itself 1,750 times over, adding $6 million and produces $10.5 billion in economic benefits and over 174,000% return on investment. These findings and these startling returns are the reason why the Wham Report was created, to share this important data with researchers, economists, funders, entrepreneurs, advocates, policymakers, and business leaders. We're bringing leaders together across these disciplines and research focuses to find new opportunities to create real change in the status quo. Fixing disparities in health research by increasing investment is in our best interest, not only for our health, but for our economy. Wham and other groups of passionate and courageous women and men will change the status quo, and the Wham Report can be a catalyst to support the aggressive change we all seek. We've just talked through some powerful returns and big numbers, but what does having this data really mean, and how will it change our investment in women's health? How can we continue to make decisions based on information that excludes 50% of our population, nearly half our workforce, 60% of our wealth holders, and 85% of our spenders? Well, we can't, and we shouldn't. No CEO looking at this data could argue to blindly continue with the status quo, because no business could afford to. Nor can we, as morally and ethically responsible individuals, turn away from these facts. Beyond quantifying costs and benefits, the Wham Report is an accountability index for change. Our vision is that the Wham Report offers you a new platform, a new roadmap to inspire the kind of lasting change we all know is right for the durable prosperity and well-being of society. Thank you so much for inviting me to share the Wham Report with you. And now I'd like to turn it over to Susan Denser, Research America's board chair and senior policy fellow for the Robert Margolis Center for Health Policy at Duke University. Susan is an elected member of the National Academy of Medicine, formerly the Institute of Medicine, and also serves on the board on population health and public health practice of the National Academies of Science, Medicine, and Engineering. Susan will lead a dialogue with our scientific partners and collaborators to hear more about how they are using this data and how it might change their thinking, their actions, their work, and their institutions. So thank you, Susan.
Thank you again, Carolee, for that generous introduction. And before we go to our panel discussion, we're very happy to be joined by one more member of Congress, Representative Haley Stevens, Democrat of Michigan. She chairs the House Subcommittee on Research and Technology and the bipartisan Women in STEM caucus, STEM, of course, standing for Science, Technology, Engineering, and Math. That caucus brings awareness to the policies and programs and initiatives that support women in STEM fields and develops the next generation of women leaders in STEM to advance research by and for women. So Representative Stevens, over to you.
Well, thank you so much, Susan, and to all of WHAM. Thank you to Carolee Lee for organizing this just essential briefing. I'm here with several of my colleagues, and we're here to make sure that this briefing gets all throughout the halls of Congress. I so respect and admire this data-driven approach to this incredible report, this enlightening and eye-opening report. And along with data-driven, we also have to bring in the empirical voices, the individuals, the women who we represent here in the halls of Congress, because the anecdotes are so real. Overlooked diagnoses, lack of research to funding for a cure. Just yesterday, I was on the phone with a constituent who is going through another round of treatment for ovarian cancer. It's just been a 12-year journey for her. And we started talking about the funding. We started talking about the research. And she said to me, you know, it's just such a small segment of us. It's not big enough. It doesn't catch the attention of the pharmaceutical manufacturers. They don't see a profit-making opportunity. This is why what we are doing here today with Wham, and I love the acronym, but I love what the acronym says more. Women's Health Access Matters. We have to wear that badge because it's Congress who's going to make that investment. It's Congress who's going to prioritize it. And for every woman who's in a doctor's office, and I so appreciated the RAND presentation about the rheumatoid arthritis points that were made, because for every woman who's sitting in a doctor's office, frustrated, angry, not feeling heard, and the doctor is using the research that is given to them. The doctor is using the training that is given to them. The doctor is only going to be able to use the tools. It almost doesn't matter the gender. So we are here taking responsible action, and of course, looking at the history. You know, with 1990, really wasn't that long ago. I'm going to go so far as to say maybe almost every single person here was around in 1990 when the Congressional Caucus for Women's Issues raised the question in a GAO report about the inclusion of women in research populations conducted by the NIH. This GAO report, then published, exposing the NIH that they had virtually no understanding of the impact of its research for women's bodies. Think about what we are talking about in the Congress right now. Womenomics is what our speaker calls it. This is all connected because we are taking votes, and it's in a series of votes. It's not just one bill that's going to solve all of our problems. Think about what we are asking for, because it was only in 1990 that this outrage was exposed, that we were not even making those investments. We can't be stuck in the past, right? We have to invest in women's health. We have to invest in the paid leave. We have to invest in the daycare. It's all interconnected. And we're grateful for our female leaders in the Congress. We're grateful for people like my friend Don Beyer, who's on the Science Committee. He's one of my favorite members of Congress, and he's an amazing spouse who I got a chance to meet last week, who I know has a lot of influence into his work as well. But we're glad that the NIH sprung to action and created this Office of Research on Women's Health. We have to demand more. We have to demand more. It is an injustice that we're in a country as great as the United States of America, and maternal mortality is at peak and unacceptable levels. Problems persist. We must ask questions. You have asked the right questions that have produced the right report. And I, alongside all of my colleagues, are ready to dive into action to address these disparities. We obviously have to talk about our women of color. You know, I just read another alarming report about what women of color are also going through, the intersectionality of that disparity. So we don't just say, oh, it's unfair. We say, hey, our sleeves are rolled up. This is how we're bringing our country back. We're ready to act now. So thank you so much to my friends from Wham who brought me here with you today. And I'm actually very excited to listen to this panel, and I'm going to do just that. So thank you, Susan.
And thank you, Congresswoman Stevens, again for your extraordinary leadership in this cause. So the history that you just heard Congresswoman Stevens cite really is instructive. As she mentioned, that GAO report in 1990 highlighting how little, relatively speaking, research was being done on women in clinical trials led in part to the appointment in 1991 of Bernadine Healy as the first female head of the NIH, and she launched the famous Women's Health Initiative study to look specifically at the area of menopausal therapy and the impact on women's health from that. A very important, long-lasting study that made a huge difference in how women were treated. Then we fast forward about another decade, and in 2001, we got the issuance by the Institute of Medicine of a consensus study on sex and gender differences. It was called Exploring the Biological Contributions to Health, Does Sex Matter? And the answer to that question was, yes, indeed it does. So 1991, 2001, here we are in 2021, with the Wham Report. So I guess we could say that interest in women's health research, maybe we do a little bit better than following the life cycle of cicadas. That is, every 17 years we wake up and realize that there's something here that needs to be noticed, but we're not doing as well as we could be doing in understanding the role of sex and gender differences and the import of this kind of research. So now we have the new Wham report and a clear economic and societal framework to understand the impact of this research and to look specifically how we make greater investments in this research and the payoff that we'll achieve from that. Very, very important takeaways. I think another really important takeaway of this report is if you look at the underlying assumptions that were built into the RAND micro-simulation model, they are very conservative assumptions. The RAND model assumes that we would double current investments in NIH research in these three disease categories off of what is now a very low base. So we're not talking about quintupling or even greater increases in a huge amount of research that is already underway. No, we're talking about doubling a relatively small amount of research. In addition to that, the RAND model assumes a very small payoff in terms of improvements in health, 0.1%, right? So that also is a very conservative assumption. And it also finally looks at the rate of return over a 10-year period, which in itself is low because, as we know, it sometimes takes decades for scientific research to translate into treatments and diseases and improvements in health. So all along the way, this report has conservative assumptions in it about the payoff, and yet the payoff is huge. As we heard, just in rheumatoid arthritis alone, 174,000% increase in terms of the return on investment from doubling the current amount of research. So just to put all of that in perspective, at how important it is even to make these very modest increments in investment and research. To talk about all of this and where we take this information going forward, we have a really impressive group of scientists and advocates and as we've heard, policymakers here today to talk about that. We're going to, in the interest of time today, not be taking questions from the audience, but to ensure that we do have an ability to answer any questions you have, please do send any questions or comments to info@whamnow.org. Again, that's info@whamnow.org. We will be sure to take your questions and get them to the right people to answer them. So please do avail yourself of that opportunity if you wish. I'm now going to introduce the panelists one by one and give them each an opportunity to share with us how they interpret the value of this research. And first, we're very delighted to be joined by Marcia Henderson. Marcia, as many of you will know, is the former Associate Commissioner for Women's Health at the Food and Drug Administration. And during her decade-long tenure there, she served as a clear voice to include more women in research and in education and policy initiatives across research areas, both to build a better understanding of sex differences and health issues that disproportionately or uniquely affect women, and also get more women doing that research. Marcia created the first FDA Women's Health Research Roadmap, outlining 7 priority areas for new or enhanced research across disease areas and creating new cutting-edge areas of science. So Marcia, to go to you now, since you were at FDA back in 1989, before there was an Office of Women's Health, before there was a female NIH director, all along you've been a tireless voice for women and for underserved communities. What do you make of the findings in the Wham report, and what do you see as their import for the future of women's health research?
Well, good afternoon, and thank you for inviting me to join this panel. Let me first correct a couple of things. One, I've always been in public health my entire career, but I did not join the Office of Women's Health at FDA until 1998. So I'm sorry, 1996. So the office was in effect 2 years prior to my coming. But what I will say is that we are at a very pivotal point. And I want to just step back a minute to give a little context to why this report is so critical. As you've indicated, when I was at FDA, and our key partner was the Office of Research on Women's Health at the NIH, we worked collaboratively over my 20 years of experience at FDA. And my team of brilliant, world-class, dedicated scientists were committed to advancing the health of women using the tools that you referred to, because if you do not have specific ways to measure, if you do not have the data, you will not get to the next level. As you know, science evolves, and we were empowered by advocacy groups and Congress to be a catalyst for change. In order to ensure optimal evidence-based information to support product review decisions, we produced that first research roadmap. And we also put together 7 key priorities across the entire agency focused on women's health that we did collaboratively with the centers and divisions. And I only say that to say you have to integrate your activities. You've got to get the money to be able to do it. And the way that we were able to do it was with cash. I have to be really candid. The fact that Congress gave us money helped the agency pay attention, so that when we solicited their support, we were able to help fund the internal support. So we had a lot of firsts related to moving the needle from about 23-24% inclusion of women in clinical trials to now between 50 and 60% of all approved drugs at FDA being having that proportion of women in those trials. The thing that I would say most importantly to me about the Wham report is that it provides essential new information. Yes, for 30 years, we've known we have a problem with the health of women. But what's different? Why now? I believe that we're at a critical point in time. We're coming out of a pandemic, and it has unmasked problems for women in the workplace. It has unmasked issues for essential workers. It has unmasked disparities based on race, ethnicity, age, pregnancy, and geography for women. But it's also given us an opportunity. The Wham report has clearly identified specific diseases and chronic conditions that disproportionately affect women. But it has done much more than that. it has given us the costs associated with them. We can no longer hide from what this is doing to our economy and to our families. As the Congress people who just spoken have all indicated, this is real in the lives of real people. And the potential benefits and savings are enormous. And this is why I'm dedicated, even in retirement, to this new call to action.
Well, Marcia Henderson, thank you so much for your eloquence on this subject, your power for your history. Thank you also for correcting the historical record on the timing of your arrival at FDA and your work at FDA. And thank you again for all of the support and inspiration you've provided to the community. We're going to go next now to Dr. Erica Holman Sapphire, who is the recently appointed president and CEO of the La Jolla Institute for Immunology. Her work focuses on immunity, and she's been a leader in COVID research, the very important area that Marcia Henderson just referenced. Dr. Sapphire has also been a leader in collaborative research and working to make data more open and accessible across the various research silos to advance and improve science. Dr. Sapphire, your research has focused on viruses and the human immune response, which of course the COVID pandemic has thrown into great relief. But you also know that the Wham Report focused very particularly on rheumatoid arthritis, an autoimmune condition, obviously very much linked, clearly linked to the immune system that you have spent your career focusing on. And as we know, and as we heard the congresswoman say earlier, this disease state has a huge toll on women. As much as 1% of the population overall affected by rheumatoid arthritis, but twice as common in women as in men, creating a range of poor long-term outcomes. Now, these have been reduced to some degree by some of the therapies that we now have available to treat rheumatoid arthritis, but the long-lasting social burden of women being impaired, the quality of life impairments, the disability that results, that hasn't gone away and remains a very important area that we need to continue to come to grips with as we think about making investments in research. So let me ask you from your perspective at the Institute, and again, looking at the data that shows with just a $6 million increment in investment and research on rheumatoid arthritis affecting women, we could generate a $10.5 billion return over a 10-year period. How does that data affect your thinking about allocating resources into scientific research?
It's definitely compelling data. The Wham Report clearly demonstrates for us something that we haven't put enough attention into, which is the economic benefit to the nation, that very significant return on investment for biomedical research that addresses differences in the fundamental immunology between men and women. And that research shows us how we can use those differences to make better treatments and preventions for both sexes. So we all grew up thinking that sex differences had to do just with gender-specific hormones or organs. But it turns out that our immune systems are different too. There are a lot of immune genes that are encoded on the X chromosome. All cells in a female body are XX, every cell. All cells in a male body are XY. As a result, females have twice as many copies of those immune genes and twice the repertoire from which we can draw. Females have a bigger palette to paint from. As a result, females can make much stronger immune responses. And that's really important because nearly every human disease, including ones you would not think were related to the immune system, like heart disease and cancer and neurodegenerative disease, have a fundamental immune component. So those immune differences mean that females clear viruses faster. Females are more protected from heart disease, but females are much more prone to autoimmune disease like rheumatoid arthritis, and females are more prone to Alzheimer's. Now, those differences give us the biological variables to test and research. And those differences give us that clear path forward that we need for research that will ultimately benefit both genders. That Wham report demonstrates the broader and larger economic benefit of that research. So you asked how that shapes the way I lead La Jolla Institute for Immunology. What it means is putting a renewed emphasis on understanding and learning and harnessing those sex-based differences in immunology across all of the research programs of our institute for both women and men. Because it lights the way forward to treat heart disease, cancer, autoimmunity, infectious disease, and the inflammation that makes us hurt every day. The immune system has an incredible power and complexity. Research that lets us understand how to use that, how to harness it, lets us treat and prevent nearly every human disease in both men and women, boys and girls. For specific diseases, when you're talking about the new immune therapies you mentioned, if they've only been tested on male animals, you've missed the opportunity to harness that greater inflammatory power. You've missed the opportunity to figure out if a different dose would work better in one sex or another. Women can have twice the adverse effects for some therapies. For other immune therapies, it only benefits women and not men. If we can understand those differences in the fundamental immunology that are different between men and women, we can treat both sexes better.
Great. And again, an extremely important call to action, particularly at a time where we now understand better than ever the importance of the immune system coming out of the pandemic. We're going to go next to Dr. Jennifer Hall, who's the Chief of Data Science at the American Heart Association and co-director of the Institute for Precision Cardiovascular Medicine. Her work spans health, technology, and science, and using new data analysis techniques to bring about precision medicine. So, Dr. Hall, again, with fairly conservative assumptions, the RAND study projects a 9,500% return over 10 years from doubling the NIH investment in research on women and coronary artery disease. As you think about how those additional resources could be put to use in research, what does your work in data science suggest would be the most fruitful areas of that investment to be? And what might we see at the end of a decade or beyond of investment in that arena of research?
Geez, you'd think I would have that down by now. Anyway, I want to thank you and just simply reiterate something that Erica said to answer your question, Susan, and that is data coming together from the immune system now that comes into our area of cardiovascular disease is so important. And so bringing all these data points together, and we don't work as silos anymore. Erica's team on immunity works with cardiovascular experts at the La Jolla Institute. In this Wham report, it's another great use case of cross-fertilization. You bring business experts, economic experts, and data scientists together in different fields, and this is the outcome, clear data points that need to be resolved in our future. As you know, heart disease is the #1 cause of death in women and men and people of most racial and ethnic groups across the globe. And it's costing our economy $555 billion a year. And so any way that we can invest in women, currently 4% of the research dollars in cardiovascular disease are invested in women. That's a tragedy, quite honestly, to be quite frank with you. And I think what we really want to see and what's starting to move in our field is that we can now look at a lot of data together, billions of data points that we've opened, Erica has opened, people all over the world have begun to open to say, let's share our data so we have more evidence to test hypotheses and to get better treatment to patients, both men and women, and people across all racial and ethnic groups. For example, we don't have enough data currently in different underrepresented groups today to be able to give them precise information about treatment and prevention. I think a key point that you said, in 10 years, what could we potentially have, is that we're starting to see the beginning now. There are predictive algorithms that are being incorporated into the electronic health records that help us understand and get an earlier idea of high blood pressure, get an earlier idea of coronary artery disease across all individuals. So before, just think of it, you go into your doctor's office, you get your blood pressure taken every year, and they see you have, it's going up every year, like most of us are having that same issue. But in 10 years, we'll be able to predict, or hopefully we'll be able to predict, what is causing that and how do we prevent that at an earlier stage. Hypertension is one of the major reasons we have heart disease today. And so building these predictive algorithms to figure out who might have a stroke, who might have cardiovascular disease, and how do we intervene earlier is the way to go. And we're getting there, but we certainly need better attention paid to women. Thank you.
Great. Great. And Jen, indirectly, you've made the very important point that research on women isn't just going to affect the health of women. I mean, if women and men are different, it's going to be as important for men to understand those distinctions, correct?
Absolutely. And as you all know on this call, most women are the caregivers. Most women are the matriarch of the family, holding that family together. And so impacting, putting more funding towards women in all of these particular areas, not just cardiovascular disease, has shown in the economic modeling that it's a huge return on investment because it benefits everyone, the family, the elderly, and all individuals.
Great. Well, thank you so much. We'll go next to Dr. Sharon Rossi, who's the Director of Neuroscience Programs at Bright Focus Foundation. That foundation funds innovative scientific research worldwide to defeat Alzheimer's, macular degeneration, and glaucoma. Dr. Rossi manages Bright Focus's Alzheimer's disease research program, which is currently supporting 133 grants around the world and a $35 million total investment. During her previous tenure at the National Institutes of Health, she played an integral role on National Institute on Aging projects related to the impact of aging on the brain. So, Dr. Rossi, Bright Focus is leading some of the most innovative work in Alzheimer's disease and other areas. And one very important way you do that is by funding promising young scientists to seed the innovative work in their laboratories that can be developed and lead to hopefully the next breakthrough. And that kind of early stage and early career funding is so important for science, so important for women scientists in particular, and sometimes very, very difficult to secure. And in the current era, particularly difficult to secure. There is so much competition for limited amounts of funding coming out of NIH and other fields. So I'm interested in your perspective as a young researcher yourself. How did you first learn about sex and gender differences in research in that time? Were you encouraged to explore these areas as funders and institutions direct more spending to sex and gender research, we hope, and specifically work focused on women? What do you think we can best do to assure that young researchers go into these fields and stick with it? Because as we know, it will take a long time to really see rates of return in areas like Alzheimer's research.
Yes, thank you, Susan. Excuse me, and thank you to Carolee and Wham and the congressional hosts for having me here today. The disparities in women's health research is very important to Bright Focus Foundation, as all three of our diseases disproportionately affect women. And we're proud to say that we're actively funding $3.5 million in research efforts right now that are looking specifically at sex-based differences in Alzheimer's disease. But this is also why we're so excited about our partnership with Wham, not only to increase awareness and funding around this very important topic, but also to bring like-minded scientists like we have here together to discuss commonalities or common features or mechanisms that can be leveraged in the future to develop better therapies and treatments for all of our diseases. And so you asked if I was encouraged to look at sex differences during my research. And I think a pivotal point in my career was at the National Institute on Aging, and we were looking at age-related changes in the brain using functional MRI. And even though the NIH has required using both sexes in animal research, I think what happens all too often is the statistical difference that occurs due to sex is averaged out of the equation to see whether or not an effect still stands. And nobody's really looking specifically at the mechanistic differences that are driving those sex-based differences. And so when I took a look at the difference between aged male and female brains, the differences were so striking that I thought, wow, if this is what's happening during normal cognitive, normal aging, normal cognitive aging, what's happening when there's underlying disease processes, underlying degeneration? And so I'm happy to be able to take that knowledge and that insight and incentive and drive to Bright Focus, where, we really think that education and knowledge is power. So we don't only fund exceptional research, we also educate the public and early career researchers. So next month, actually, we're having our annual Alzheimer's Fast Track, which is an immersive workshop for young researchers to come and attend. They get to network with experts in the field, and we talk about the unmet needs in the field and where the field is going and where we should concentrate our research efforts. And we have an entire panel based on sex-based differences and racial disparities in Alzheimer's disease. And so we often talk about, personalized medicine or precision medicine. And I think until we start understanding the fundamental differences that sex and gender and race can play in these neurodegenerative processes, only then can we get to this ultimate goal of precision, individualized medicine. And so I'd like to thank all of you for your time and efforts, and, everybody here for bringing this topic to attention, and hopefully, get this process going and move the field forward.
Well, thank you, Sharon Rossi. And just to follow up on what you said earlier, that nobody, even at NIA, nobody was really looking at these systemic differences between the sexes on even just the impact of aging on the normal human brain. Why or why not?
I wouldn't go so far as to say as nobody's looking. I think over the course of my 6 years there was more and more, emphasis toward looking specifically at these differences. I think it's just too far between. We have a lot of catching up to do, as we've brought up today, and there's just not enough going on right now. And it's too easy to explain away by technical scientific reasoning to explain away not using both sexes in research. Instead, we should be, instead of using that as an explanation for not conducting the research, we should be using that as an idea to get more funding for that specific research.
And again, not to really throttle you to the ground on this, but you said explain away. What would be a motivation for trying to explain that away versus seeking a more fundamental understanding?
Well, I think that there are technical reasons sometimes. For instance, in spinal cord injury, females are actually used more than males as animal models for technical reasons because of bladder dysfunction. But, I think other times it costs a lot of money. You have to double the number of animals. There's ethical concerns, there's financial concerns, and there's time concerns. I mean, we're literally doubling the amount of work and the amount of money that has to be put toward one single project to look specifically at differences in sex. And, sometimes when you do that, you'll notice a trend, that maybe this is significant in females, but not males. And then you need to go back and apply for more funding to increase your numbers to look at males now. So I think there's a little bit of a vicious cycle that needs to be addressed.
Great. Well, thank you for sharing those insights with us. Now we're going to go to Jennifer LeRae, who is the Vice President of Strategy and Communications at Research America. As you heard, I'm the chair of the board of Research America. I'm delighted to count Jenny among our very distinguished colleagues there. And in her work at Research America, she works to advocate for science, discovery, and innovation to achieve better health for all. Jenny knows Washington, D.C. and health advocacy inside out. She served formerly as chief of staff to former Senator Barbara Mikulski from Maryland. She was the legislative director to Congresswoman Nita Lowey, whom you heard mentioned earlier, former member of Congress, from New York. And she also served as deputy assistant to the president in the Clinton White House, as well as having led the Susan G. Komen Advocacy Alliance as its president. So a long and distinguished track record in advocating for women's health research. So Jenny, as you've conducted that advocacy over the years and actually written legislation to advance women's health and science and research, based on your read now of the Wham Report, what do you see as the best path forward from an advocacy standpoint to accelerate research focused on women?
Thank you, Susan. It's terrific to be here, and I'm so excited about this report. I really feel that it adds a level of energy and excitement to the many of us who have worked on women's health advocacy over the years. The data is very powerful, but we know from our work in Washington that information by itself doesn't make change. Advocates do. And there's a long history of women's health advocacy, which you heard, much of it conducted by the women members themselves as they became more of a critical mass in Congress, but also by the breast cancer community. This report is great fuel for achieving progress. I'm really interested in working on what are the policy ramifications of this report. So I really appreciated what Sharon talked about in terms of some of the real barriers in terms of using female mice and female tissue. Both Nita Lowey and Barbara Mikulski, and I think they each thought that they had made this phrase up themselves, but they would both say at the ends of their talks about the importance of increasing women's health research, they'd say, even the lab rats are male. They always got a big laugh. Well, this was 20, 30 years ago. The lab rats are still predominantly male. How can we create greater incentives for researchers to use female animal models? And also, to what extent can we address gender differences through clinical trials? So I guess what I'm saying is one of my questions would be, how much of this problem has to do with the animal model, the preclinical stage? How much of it has to do with the clinical stage? So that would be one key policy question to get our arms around. And then also we need to set up a system to measure progress. One of the reasons that women are now more than 50% of clinical trial participants is because the NIH was required to measure its progress towards that goal on a yearly basis. And again, the women members of Congress held them to it. So measuring progress and accountability is key, as is the use of this wonderful information by advocates. I think I'll stop there, Susan.
Great. Well, thank you, Jenny. And again, thank you for your great work over the years in advancing this cause. I just want to take a moment to summarize what we have heard from our distinguished panelists today, because you've heard some very key themes that we need to continue to talk about a bit. So Marcia Henderson made the very important point that what enabled her work to happen around advancing women's research at FDA? Money. Congress gave the agency the money to do it. And as a consequence, and as you heard, so much change occurred with more than 50% of clinical trial participants now women, off of a very, very low, almost non-existent base earlier. She also pointed to the importance of this moment coming out of the pandemic, unmasking the disparities across the board in racial, ethnic, and gender. the important new findings now on COVID and pregnancy being a case in point. So money is important and timing is important. And this is a very important moment to seize the attention of policymakers on this issue. From Dr. Sapphire, we heard that very important has been the process of science in moving from its understanding and its early grasp of what was causing differences in sex. That is to say, an assumption that it was largely the reproductive issues and gender-based hormones that were most of the difference, to now the understanding that we've been able to build from genomic research and the notion that if you've got two X chromosomes versus an X and a Y chromosome, you're going to have even differences in your immune system. And we now know, thanks to all of that work, that the female immune system is very, very powerful and can combat a number of conditions even more effectively than the male immune system. But the side effect of that is autoimmunity as well. And so as we have gone further in our understanding of these sex-based differences, we've been able to reach into new areas beyond just gender hormones, beyond the reproductive system, to this very, very important area of immunology. From Jen Hall, we heard, again, with heart disease being the #1 cause of death in women and in men, that in particular makes the level of investment in research on women and cardiovascular disease, in her words, a tragedy, as she said. And we now have not only the imperative to understand more about women and cardiovascular disease, we have billions of new data points to bring to bear on that work. We've got much more precise information now on the causes of heart disease. We will have much more precise information on the ability to prevent heart disease from the kind of predictive algorithms and other data tools that she mentioned. So sort of back to the notion of the moment, this is a very important moment given our data tools and data science to be able to propel this field forward. From Sharon Rossi, we heard about the issues of the lag in understanding differences in male and female physiology in normal times, let alone what happens in the disease context. She mentioned the dawning awareness over many years at the National Institute on Aging, and also the very excitement around what the work that she is doing now to advance young researchers in these fields. She referenced the annual Fast Track event that Bright Focus is sponsoring with a panel focused specifically on sex and racial differences in Alzheimer's disease. So again, just the enormous opportunity, again, back to the moment idea and the money idea, getting younger women researchers in particular motivated to address some of these fundamental conditions and differences in sex and gender in very important disease conditions such as Alzheimer's disease. And then finally, we've just heard now from Jenny LeRae about how all of these data inherent in the Wham report, all of these projections, this important microsimulation model, all of that is really, really important, but it's not going to be enough to make change. We're going to need a broader movement, as we have seen in the past from the breast cancer movement, as she referenced, hearkening back an earlier generation to HIV/AIDS. It takes people mobilized to make a difference. So as we think about mobilizing people, that will be another topic I hope our panel will address. Let's figure out what we can do in that vein. The other very important point that Jenny left on the table is let's get more into understanding what are the real barriers here to advancing this field from a technical perspective. Is it the fact still that so many of the lab rats are male, as she mentioned? That is one of the impediments to making more progress here. And very importantly, once we understand more about those particular barriers, how do we make progress and how do we measure that progress? And how do we hold the scientific community, broadly speaking, accountable for making progress? So with that as a kind of a background to the discussion that we'll have in the next few minutes, let me ask you all importantly about next steps. Where do we go from here? If we appointed all of you as a leading panel of advisors to members of Congress, to others in the scientific community, about the most important next steps that we have to undertake to move forward based on the Wham research and other findings that we're well aware of, how do we make a difference as fast as possible? And Marcia Henderson, I'm going to come back to you for the first crack at that question. Most important next step.
Well, I do think that educating with this report is critical. Advocating for more resources is essential. I've known Jenny for a very long time. She's a consummate advocate, and that's how I met her as a Fed, listening to the pounding at the door of you must make these changes. And I think that it's one of the things that we learned over the years is that every entity that is concerned about women's health has to be involved. The policymakers, the health professionals, the researchers, and of course, women themselves. I don't know that women know about the Wham report. And we make economic decisions every day, which has been pointed out. We are making the health decisions. We're investing in our families. And this is a message that I think needs to get to women, because women are very good at lobbying for their own best interests and the interests of their families. So I would say that although this is going to Congress and clearly they have the power and can generate the resources, I think that it would be very good also for women and health professionals to understand what the economic issues are around these particular disease conditions.
Great. Okay. So again, another wonderful call to action. Get the word out about these findings and about this and very, very important imperative to grow women's health research. Jen Hall, I want to go to you next. Most important next step in your view.
I think understanding, the challenges in Congress today, one of the things that would be important to point out is that money, funding invested in healthcare impacts our economy overall and impacts the quality of life of all individuals. And I think the United States needs to be a leader in this area. If the United States leads, people will follow and we will see a global change. And I think it's a great opportunity to start seeing that change now.
Great. Erica, Sapphire, let's go to you next. Thinking about the most important next step that could be undertaken now to really propel forward investments in women's health-related research.
I see two. NIH initiatives looking for programs understanding sex as a biological variable. I mean, this is research we're doing anyway. Why does someone get sick? What is the mechanistic basis of whether that's heart disease, autoimmune disease, cognitive decline? Research specifically looking for those reasons will help us treat and prevent them. And then companies need to see the opportunity here. If immune-based therapeutics are some of the blockbuster drugs in the greatest area of treatment opportunity, those antibody-based treatments are going to launch a female immune system in a very different way than males. We don't sell the same blue jeans to the two sexes. There's an opportunity to make therapies that are going to treat people better, like jeans that'll fit people better.
So you're making the very important point that this doesn't necessarily only apply to basic scientific research. The applications of basic science research as we go into research and development of treatments, and of course much of that development work, if not almost all of that development work, is taking place in industry. Is industry sufficiently aware of sex and gender differences? And should we be raising awareness even much more broadly beyond just basic science?
I suspect not. Women are often, the differences between sexes are often attempted to be addressed just by body weight dosing. But women are not smaller men. If a certain dose of an immune-based therapeutic will launch a much more powerful and immune and inflammatory response in a female, you need to fundamentally change the, for example, the molecular structure of what interacts with those immune cells to get the right response in one group than another. The market is large, and this is a treatment opportunity that will keep, for some therapies, females from dropping out of treatment because of the adverse effects. And in other diseases, let the males have some benefit. There are antibody-based treatments that only work in females and don't work in males. That's a problem we can fix too.
And again, underscoring a point that we addressed earlier, which is that this research that focuses very finely on effects in women will illuminate what is going on in men as well. So there are going to be many, many spillover benefits from focusing on women. It is not just the female sex that will benefit from sex-focused research. So Sharon Rossi, to go to you now, your preferred next steps. Again, if you were on this mythical advisory council that I've now created to advise Congress on this set of issues, what would you say are the most important next steps?
So I would echo what has been said already. I mean, we need to increase awareness and funding and develop new initiatives. But I think what's really important in those initiatives is harnessing and leveraging cross-disease conversations. I mean, especially for Alzheimer's disease and neurodegenerative diseases, they're very holistic diseases. Alzheimer's disease involves almost every single system in the body, your immune system, your endocrine system, your cardiovascular system. And meeting, these wonderful ladies, at a Wham event we had, everything just kind of started, I think, coming to fruition. We started seeing all these connections between our diseases, and there might very well be one underlying mechanism that we can all benefit from. And I think, cross collaboration is really the way to go moving forward.
And in effect, you're referencing a longstanding problem in biomedical research, which is that we have tended to address these various conditions in silos. Obviously, that's been of concern to the leadership at NIH for quite some time, going back to former NIH Director Elias Zerhouni and the roadmap. How do you break down the silos in research? Could it be, in your view, that by focusing on sex-based differences, that could be another lever to drive this breaking down of the silos focused on research and really create a more holistic, cross-cutting set of research questions as you've just described?
I don't know if it just adds more work. I mean, or maybe we'll answer more questions. I think we're really at the infancy of this kind of nexus that's hopefully about to happen that we're all kind of touching on here. And I think we all need to keep talking and keep collaborating to move the field forward in the right direction, and keep bringing the awareness, and hopefully the money and the research will follow. So.
To echo something Dr. Rossi said earlier, all you can ask for in science is a clear variable and a clear result. Only when Dr. Rossi thought to compare the brains of females and males did she uncover a difference that no one had thought to find before. Only when, Lynn Hedrick and my institute, Lohr Institute for Immunology, thought to separate male cells and female cells did she see differences that no one had ever seen before. You have to ask the question.
You have to ask the question and take off the blinders first before you ask the question. Thank you very much, Erica, for that comment. Let me go finally to Jenny LeRae. Jenny, in your new role on this mythical advisory group that I've created in my head here, what advice do you give to policymakers about the most reasonable, rational, impactful next step forward?
It's a very hard question to be the last one of 6 to answer, because each woman before me has made such an excellent point. And I think together we've created Wham's strategic plan for implementation of this report. Again, I get back to the ask. You know, what is the ask? So what are the policy changes that we seek? That's not something to ask Congress to figure out necessarily. Sometimes you do, you go to GAO, but I think there's enough wisdom and enough experience that we can come up with some of those policy objectives ourselves and share those with Congress.
Great. Well, again, just to summarize these great next steps that you all...
And one moment, could I just add one caveat?
Please, Marcia.
Any resources that go to the NIH for these wonderful new discoveries will come through the FDA. And so as money is generated for research, do not forget regulatory research, because that is a very different way of looking at the same data. So I always want to put in a plug, because research often equals NIH. I wanted to also have a portion there that equals regulatory research, which is a translation so that the treatment will be evolved for women as well as for men.
And Susan, if I could just echo what Marcia said, you know, unless the FDA has the resources to train their staff to understand how to use gender data in their decision making, these products just aren't going to come to market. So here, Marcia, very good point.
Right. And thanks both of you, because it is a pipeline, right? It starts with basic research. And as enthusiastic as we can all be about science, what we really get excited about is when science translates into discoveries that translate into treatments and therapies that improve health. And also that lead us to greater understanding about how to prevent these conditions in the first place. So FDA being at the critical juncture of how those therapies and treatments come to market, those investments in advancing the the regulatory science process become as important as ever. So again, just to summarize, we heard about next steps: awareness, making women broadly aware of this research. We just now heard about the importance of not forgetting about the regulatory piece of this as well. We've heard about the need to have companies and industry also understand the opportunities in gender and sex-based research, to be aware of the fact that women are not smaller men, as Erica Sapphire said. We've heard from Sharon Rossi not only to think about increasing funding, but also to take advantage of the ability to harness and leverage knowledge across disease conditions, to understand, for example, as she said, that Alzheimer's affects every system in the body. So we've got to connect Alzheimer's related research on women to other organ systems and differences in gender and sex-based research. And then finally from Jenny about the very important need to be specific about the policy changes that we seek, basically to refine the ask. In addition to the money, what are the other elements of the ask that the community wants to make? And we've heard some of them talked about just now. And certainly, as Jenny said, there's opportunity to keep this conversation going and refine the list of things on that very important set of asks to really move forward. With that, I want to thank this panel for a terrific discussion, and I'm going to turn things back over now to Carolee to close out our terrific meeting today. Carolee, over to you.
Well, thank you, Susan. And thank you again to our wonderful congressional hosts for their passion, their enthusiasm for the Wham Report, and their leadership. And of course, thank you, Susan, for leading such a rigorous and thoughtful discussion that's brought the scientific perspective on this data to life. Of course, I have the advantage of these women and this wonderful group of being our partners and our collaborators. And so We maybe have a cutting edge here on creating all of those wonderful new ideas that you've just discussed. And thank you, Marcia, for your incredible insights, and to Dr. Hall, Dr. Sapphire, Dr. Rossi, for their terrific collaborators at the American Heart Association, La Jolla Institute for Immunology, and Bright Focus Foundation. We could not do this, obviously, without you. Wham created this report to drive change, and it's thrilling to hear from scientists across disciplines, from our partners and our collaborators, how they're going to use this data to transform their thinking and their actions. And we invite all of our guests to use this data as well. You can find the reports on the whamreport.org. And I just want to end, you asked the question of what next, perhaps, Susan, and I'm going to answer that a little bit as well. There's a wonderful quote from Margaret Mead that I've often referred to, which is, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has. And so thank you again for all of everyone's hard work and support, and I hope to see you all again very soon.